Hey, brand new CNA. I was told that you have to empty someone's colostomy bag and you're nervous. But great news. I was nervous too and I started, so I got you. My name is Nurse Eunice. I am the owner of Florida Training Academy. And in today's video, I'm going to show you how to empty the contents of a colostomy bag while communicating with your patients. And so a patient may have a colostomy because maybe they had colon or intestinal cancer, maybe because of traumatic injury such as a gunshot wound. And now we have to find a bypass for the stool to escape their body, but it can't go the traditional path because maybe some of the intestines were removed. And so a colostomy can be on either the right side of the patient's body or the left side. But Mrs. Lucas here looks like she's had a lot of stomach issues and intestinal issues because she has her gastric tube on one side and her colostomy bag on the other. And so the portion of the intestine that comes out of the skin is called a stoma. The stoma should be beefy red. If it has abnormal drainage, if it's not beefy red, let's say it's turning black, that's necrosis or a sign of tissue death. That would be something you want to let your nurse be made aware of right away. So right now, her stoma appears normal. She's given me permission to perform the skill, and I have all of my supplies here. Let me bring them closer now. So here are my supplies. Of course, I have clean, gloved hands. I like to put a towel on the table. Not only is the bedside table your patient's eating surface, it is also the surface that the nurse uses in order to prepare medications, procedures, etc. So I try to keep the bedside table as clean as possible, and we never put a bedpan directly on top of a table without some type of protective covering. This is a bed protector. You may call it a chucks. I'm going to use this to make sure that I keep the bed clean and that none of the contents actually drip on the pad beneath the patient. Because if I do, I just gave myself extra work. And who wants to do extra work? You're going to need toilet paper or wipes because once we expel or remove all the contents from the bag, we have to wipe the end of the bag. And so those are the supplies that I have. We're going to get started. I'm going to begin by lowering the rail on the side nearest me. You're going to use your towel or your disposable pad. I'm going to smooth my patient's arm over a little because I need to make sure my bedpan will be flat, because once I open this clamp and pour all of the contents into the bedpan, I don't want this leaning or anything, and I don't want the patient to accidentally hit it and make it spill on me or onto herself. I'm going to go ahead and pull out a wipe so I'm ready. And as much as possible, include your patient in their care. If your patient can participate, this is something that they should be doing. They should be helping with. All right, so I have everything I need. For this one, and you have to know how to work your facility's supplies, because not every device will work the same. For this one, I open the ends and then I unroll. And then you just gently expel. And depending on the patient's diet, sometimes the fecal matter will be more formed. Other times it's going to be more liquid. And I can tell that Miss Lucas either had some nuts, some oats, or some corn, because there are some undigested food particles here. And anything that you can't get out, it is okay, but get out as much as you can. So remember, this end, it still has fecal matter on it. I cannot close it like that. So I'm going to take a wipe. I can try to expel more of the fecal matter. I want to make sure this is as clean as possible before I close this back up. All right, so here we go. Miss Lucas, you still doing okay? All right, so once I'm done, I just can't leave my patient's bedside yet, because not only is her gown still up, but her side rail is still down. So making sure there's nothing on my hands that I can visibly see, I'm just going to lower her gown. I can always come back later and make it perfect. I'm going to raise this rail. Make sure you lower the bed. I need to transport this to the bathroom. I need to empty out the contents into the toilet, and then I will rinse it. I will dry it, and I will usually just store this bedpan inside of the bathroom. As far as this pad's concerned, it would be disposed of in the trash. All right, and so now that I have performed hand hygiene, I've put on new gloves, I can come back now and get my patient situated in the bed. I'm going to remove this towel. I didn't want to expose her genital area. All right, Miss Lucas, do you need anything right now? Would you like the head of your bed raised any? Okay, I'll come back and check on you during my next rounds, okay? Great job, team. We emptied our colostomy bag like a pro. So high five with clean gloves. Bam. Don't forget you have to document, so your job's not done yet. You want to document the qualities of the stool. How much was there? If it was more formed, you can put down one bowel movement. But because it was liquid, does your facility require you to transfer the contents from the bedpan into a graduated cylinder for you to measure the liquid contents? Find out your facility's policies. What was the smell? What was the color? That would be things that you'd be documenting in your chart or on your INO form. And so I hope you learned a lot. And since I have on gloves, I want to make sure that you all remember how to take off your gloves without contaminating yourself. So team, what do I do first? That's right. If you said pinch from the palm, you're absolutely correct. So you never want to start from the edge because you're going to contaminate your skin. So we're going to pull from the palm, pinch and pull down. Secure it in your other gloved hand, 2 fingers under, fold it in on itself like an envelope, take it off, discard of it in the waste receptacle. Don't forget to perform hand hygiene. Because I was actually performing a skill that involves stool, I'm not using hand sanitizer. I am physically going to go wash my hands again. So everybody, this is Nurse Eunice. I hope you learned a bunch, and I will see you in the next video. Bye, team.